Hello, my name is Caress Perkins, and I will be doing the head to toe video. First, I will start off by checking my patient's chart. Then I will knock on the patient's door, introduce myself, provide privacy, wash my hands, and check two patient identifiers. Max your name and birthday.
Robert Smith, March 31st, 1990.
Okay. And Max, what brought you in today?
A checkup.
Okay. Are you in any pain?
No.
Okay. Who is our president?
Donald Trump,
What year is it?
2020.
Okay. And where are we located right now?
In our labor room.
Okay. So my patient is alert and oriented ×3. I'm going to, you mind if I begin my assessment?
Okay.
Okay. Any tenderness or pain?
No.
Okay. Okay. While assessing my patient's head, I did not notice any lumps or lesions. My patient's hair is black, thick, clean, and good for his ethnicity. My patient's eyebrows and mustache is thick and black as well, and bilateral. Okay. My patient temperature is moist and warm. Okay. Going to check the patient's turgor, which returns within 3 seconds, which shows that my patient is hydrated. So that's good. Okay. I'm going to check the patient for edema and muscular. Okay. My patient showed no signs of edema throughout the body. My patient's muscles are equal bilateral throughout the body, upper extremities and lower. So that's good. I'm going to check cap refills on the upper extremity and on the lower. Okay. 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 All right. Cap refills are good. They refill within the 3 seconds. So blood flow is good, upper extremity and lower. The patient's lower extremity hair is equal bilaterally, and the temperature is warm and moist as well. And the hair on the upper extremities, the arms are equal bilaterally as well. And the patient's temperature is warm and moist on the arms. So that's good as well. Now I'm going to palpate. Okay, tenderness,
No.
pain.
No.
Okay. I palpated the maxillary and the patient's temporal and felt for the pulse in place, which is at a 2+. No tenderness or pain was noted. So that's good. Okay. Now I'm going to do lymph nodes. I'm going to do right and left side. Preauricular And let me know if there's any tenderness or pain, okay? Post-auricular, occipital, tonsillar, submandibular, submental, posterior, um, cervical, um, deep chain, posterior, um, cervical, and supraclavicular. Any pain or tenderness?
No.
Okay, that's good. I did not note any, did not feel any lymph nodes, so that's good. Then I'm going to note that my patient is dressed for this assessment. My patient's posture is erect. Facial expression is erect and good. Okay. My patient's speech is good as well. LOC is intact. Okay. Then I'm going to start on the cranial nerves. Okay. I'm going to ask you to close your eyes for me. This is smelling.
Top professional OA.
Okay, cranial nerve 1 is intact. I'm going to have you look at that picture there. And, cranial nerve 2. When's the last time you had an eye exam?
6 months ago.
Okay, and they do a smelling exam on you?
Yes.
Smelling exam. Okay. So, cranial nerve 2 is intact. Cranial nerve 3, 4, and 6 make your eyes do tricks. So, I'm going to have you look at that picture there. I'm going to direct my pen light into your vision. And I got to see if your eyes will accommodate to my pen light, okay? Okay, again. All right, that's good there. Now I'm going to measure the outer canvas of your ear and eye and see if they're equal. Okay. All right. I'm going to measure your pupils, okay? Okay. I measure at a 5, so it's good. Then I'm going to have you do the 6 cardinal gauges. Okay, follow the pen light. Okay. Pupils are equal and round and reactive to light accommodation. Okay, I'm gonna go back. Okay. Do the other side. All right, pupils are equal and round and reactive to light accommodation, so that is good. Okay. Now I'm going cranial nerve 346. Okay, I'm gonna have you pull your cheeks down for me. Okay. Cornea shows no opsies. That's good. Conjunctiva is pink and clear, and cornea is sclera is white. Okay, so that's good. All right. Now I'm going to go into, so 346 is intact. Now I'm going to do cranial nerve 7, which I'm going to have you raise your eyebrows, puff out your cheeks, and smile for me. Okay. So facial movement is intentional, so that's good. Then I'm going to have you close your eyes for me and let me know if it's right or left, soft or hard, okay?
Soft left side.
Okay.
Rough right side. Soft left side. Soft right side. Soft left side.
Okay.
Soft right side.
Okay. So cranial nerve 7 is intact. Now we're going to go to cranial nerve 8, which I'm going to have you stand for me. Stand to the side. Okay. I see a little sway, which is normal. Romberg. So that's intact. I'm going to have you turn around opposite. Yep. And you tell me what I'm saying in your right ear and left ear, okay? And let me know what side I'm on.
Cat on the left side. Dog on the right side.
Okay. That's good. I'm going to have you face forward. I'm going to have you do heel to shin. All right, balance is good. Posture was erect. That's good. I'm going to have you do fingertips to nose and spread your hands out like that for me. Posture is good. Balance is good. Erect, so that's good. Any pain or tenderness?
No.
Okay. Now I'm going to have you walk from here to the TV there. Head is up. Posture is good. No imbalance. Have you had any problem with your feet or anything like that?
No.
Tenderness, standing for a long time?
No.
Okay. Any pains in your back when you walk?
No.
Okay. No shooting pains to your neck or anything like that?
No.
Okay. That's good. Now I'm going to have you sit so I can check Babinski reflex. Okay. 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 Babinski reflex is intact. Babinski. Okay. Now we're going to go into cranial nerve 8 is okay. Now we're going to move your head in circular motion. Um, invert and divert your legs for me. Okay. Yep. And move your wrist in circular motion. Okay. And abduct and adduct your arms from your body. Straight for me. Okay. Good job. All right, so cranial nerve 8 is intact. Now we're going to go to cranial nerve 9. So I'm going to have you say, I'm going to have you put your head back and swallow for me. Okay, so gag reflex is intact. Have you put your head back again. If you want to check, just pull it back here. Check for any murmurs or lifts, which I don't feel any lymph nodes, anything. So that's good. Sorry. Now we're going to go to cranial nerve 10. I'm going to have to say ah. Say ah again. Okay, soft palate and uvula raised midline. So that's good. I'm going to have you open your mouth for me again. Stick your tongue out. Hard palate is pink and moist, no lesions. Pharyngeal, pink and moist, no lesions. Buccal mucosa, pink and moist, no lesions. Tongue, say ah for me. Okay. Pink and moist, no lesions. See your gums. Let me pull you. Okay, pink, yeah, nice and pink. Gums are nice, pink and moist, no lesions. I'm gonna check your teeth. Say ah for me. Okay. I do see some dental work. But other than that, pink and moist, no lesions. So that's good. Okay. Cranial nerve 11. I'm going to, so cranial nerve 10 is intact. I'm going to have you push up. Okay. Try to get some. Yeah. Okay. Cranial nerve 11 is intact. Let's try your feet too. Raise up. Right your feet. Let me go down. Okay. So cranial nerve 11 is intact. And cranial nerve 12, I'm going to have you say light, tight, dynamite.
Light, tight, dynamite.
Okay. So that's good. So all cranial nerves are intact. So now I'm going to have you take off your shirt for me. Okay. I'm going to I'm having you sit up for me. I'm going to palpate. No comforters noted, any tenderness or pain. Okay. I'm going to measure out my lung field, which is C7 to T7, 8, 9, 10. So from here to here. Okay. So that's good there. Now I'm going to auscultate. I'm going to use the diaphragm side. I'm going to have you just breathe normally, okay? Okay. Um, no resonance noted, so that's good. Now I'm going to have you sit up for me. Okay? It's kind of hot in here. Gonna, okay? This is the notch. This is the angle of Louis. Okay? So here is the aortic, right sternal border, um, right sternal border, second intercostal space. Okay? And this is the um, harmonic left sternal border, second intercostal space. Okay, this is the Erb's point, which is third intercostal space, um, left sternal border. This is the tricuspid. It's a little dark. Tricuspid. This is the um, fifth intercostal space. I'm sorry. Aortic, pulmonic, tricuspid. Okay. This is the fourth intercostal space. I'm sorry. Left sternal border. This is the I'm sorry, that was the fifth intercostal space. This is the mitral midclavicular line. And this is the fifth intercostal space. So I just noted the aortic, the pulmonic, Erb's point, tricuspid, and the mitral. Okay. Now I'm going to listen for sounds. Now I'm going to listen for sounds. I'm going to use the diaphragm side. Okay. Okay. Um, I did not notice any rhonchi, crackles, um, or wheezes. Um, so that's good. Um, okay. I'm going to percuss. Okay. I did not hear any resonant, so that's good. Okay. Um, now that I'm here, okay, I'm gonna look for any highs or lifts, which I don't see any. So that's good. If there were any highs or lifts in the midclavicular line, there I will have the patient sit at a 45-degree angle, and if no, I'm sorry, if there was any highs or lifts, the PMI and the PMI, I would watch for 1 full minute. Um, but there isn't any, so that's good. Okay. Okay. So I'm going to check for the admitter AD. Okay, I'm having it sit up for me. Oh, I'm straight. Okay. And I'm going to have you turn backwards all the way. Okay. 1-2 ratio. Good. Okay. Now I'm going to have you say 99 as I go down J-Lo in the back of your back. So I'm going to have you turn all the way around for me. Say 99.
99, 99, 99, 99, 99.
Okay. The vibration diminishes as I work my way further down the patient's back, so that's good. Now I'm going to check symmetric. Okay, have it breathe in and breathe out. Okay, I'm gonna have you turn around all the way, so I can't really tell. And then I'm kind of in the way too. I'm gonna take a deep breath in and out. Okay, do it again. Okay, symmetric expansion is intact, so that's good. Now I'm going to palpate. Any tenderness or pain? Okay. No crumple is noted. Have you had any back problems?
No.
Okay. And how about any chest problems?
No.
When I did the anterior chest. Okay. And I want to note that he did not show any signs of struggle to breathe or use of any extra muscles while doing his anterior chest, and his facial expression was intact, so that's good. Now we're on his posterior. Okay, so this is the notch. Okay, this is C7. I'm having to do the chicken wing for me. C7 to T7, 8, 9, 10. So this is the lung field. Okay. And then I palpated. No, there was no tenderness noted, so that's good. So I palpated. Now I'm going to percuss. Okay. Okay. No resonance noted. Um, so that's good. Um, Now I'm going to auscultate. And I want to say when I did the aortic and pulmonic S1 and S2 was noted. So that's good. I'm going to use the diaphragm of my scale, of my stethoscope. Have you breathe normally. Okay. I want to say there was no wheezing, rhonchi, or crackles noted. So that's good. No extra sounds. I'm going to palpate. No crumpet noted. So that's good. Um, and the skin for the posterior is warm and moist. And the temperature for the anterior is warm and moist as well. Um, okay, and you can turn back around. Okay, you said you didn't have any problems to breathing or anything like that. Any heart issues, any heart problems?
No.
Okay, and no back pains, trouble with lifting, standing for a long time? Okay. Um, okay. Um, all right. Um, Now we're going to check the abdomen. Um, have you noticed any blood or mucus in your urine or bowel movements?
No.
When was the last time you had a urine or bowel movement?
Like, before we start this?
Before we started the assessment?
Yes.
Okay. And you did not notice any blood or mucus?
No.
Has your diet changed at all?
No.
Are you able to tell when you have to go?
Yes.
Have you had any constipation?
No.
Okay. Um, have you had any surgeries for your GI?
No.
Okay. Um, okay. Mm. All right. Now I'm going to have you lay back for me. I do not notice any JVD. Okay. If there were any JVD, I would have my patient sit up at a 45-degree angle, and if the JVD did not start to flow through the body, I will immediately have the patient see the doctor. Okay. has been looking at the abdominal. The umbilicus is symmetric to midline. Um, I do notice some lesions on the stomach, and the hair on the stomach is equally bilaterally, as well as the chest. Um, um, all right, you have not had any stomach pains or anything? Okay. Okay, I'm going to check into areas in each quadrant. Okay, I'm going to start at the right lower quadrant and work my way clockwise. Listening, auscultate with the stethoscope. In two different areas in each quadrant. Um, I I did not hear any um, extra sounds, um, but I did hear vowel sounds, which is normal and good. Okay. Hey, how you doing? Okay. Now I'm going to palpate, and you let me know if there's any tenderness or pain. Okay, any tenderness and pain? I did not notice any masses. Um, while palpating. Now I'm going to palpate uh, deeper and check for masses or bulges, and you let me know if there's any tenderness or pain, okay? So I'm just going deeper. Okay. Any tenderness or pain? No. Okay. No masses or bulges noted. Light or deep, so that's good. Now I'm going to percuss. Okay. I did hear timpani, so that's good. No tenderness or pain? No. Noted, so that's good. All right. And now I'm going to auscultate um, the aortic, and then the radius, and then the iliac, okay? Okay, now the radius. 2 different spots. Okay, and then the iliac. Okay. Um, I did not notice any bruits. Um, um, just normal gas sounds, so that's good. Um, okay. Are you okay?
Yes.
Sound like your stomach's bubbling now. All right. Okay, I'm gonna have you sit up for me. Okay, and I'm going to check your carotid arteries because I don't remember me doing them. I'm going to have you take a deep breath in. Breathe in and breathe out and hold it out, okay? I'm going to use the bell side. And hold it. And hold it. Other side. Breathe in. Breathe. Take a breather. Breathe in and breathe out and hold it for me. Okay. For the carotid artery, I did not hear any bruise. Okay. Um, Now I'm going to have you okay, and push. Okay. Upper body strength is good. Have the same with your feet. Push up. Okay, and push down. Okay. Lower extremities strength is good as well. Um, I'm going to check your brachial pulse. Your brachial pulse. Okay. I'll say that your brachial pulse is at a 2 plus. And check your radial pulse. Okay, your radial pulse is at a 2 plus as well. Then I'll check your tibial pulse. No, tibial pulse is here. Sorry. Okay, your other. Okay, so 2 plus. And check your popliteal pulse. Let me see that for you. Okay, so a 2+. So so it's at a 2+. Um, okay, so temperature throughout the body is warm and moist. Hair throughout the body is equal bilaterally throughout the body. Um, I would rate my patient skill score at a 15. Speech is good, posture is good, conscious is good. My patient was dressed good for this assessment. Okay, I'm going to press on the tragus. Let me know if there's any tenderness or pain. Okay, pull on the pinna, any tenderness or pain, and press on the mastoid process. Any tenderness or pain?
No.
Okay, and I did that right and left, so it's good. I'm going to examine the ear. Okay, no extra cerumen, no foreign bodies or discharge. No cerumen, foreign bodies, or discharge, so that's good. I'm going to check your nose as well. Have you raise your nose back, head back. Okay. Pink and moist. No foreign bodies. No leakage or lesions, so that's good. So, and I have a brochure for you for education on the testicular pamphlet, okay?
Okay.
For you, and there you go. All right, and that includes my video.